Hi, this is Sarah Mikesell, and today we're here with Dr. Bill Hollis. He is a practicing veterinarian with Carthage Veterinary Practice in Illinois. So thanks for being with us today, Bill.
Thank you, Sarah.
So as a practicing vet, can you tell us a little bit about how diagnostics play a role in your veterinary practice in regards to PRRS?
Sure. So when we are working with our producers, it's most important that we first understand, are we looking for the antibody or are we looking for the virus? So by the antibody, has the pig previously been exposed to PRRS, and are we just trying to identify a previous history? So we're using an antibody test. Most commonly today, we're now looking for the virus, and so that's a PCR test that we will gather either a serum sample or now even an oral fluid sample, and we'll use that to look for actually the virus itself.
Okay, very good. And what about other issues that are coming up besides PRRS? Do you use this how do diagnostics play a role just specifically in your practice?
Well, it's critical that we're making good decisions and in implementing timely decisions. And so both serum and oral fluid are very common diagnostic samples, and we can use those critical tests to look for the activity of more viruses other than PRRS.
Right.
And today with oral fluids, it's also a much easier sample to collect, a much larger sample size. And in both cases, we're really trying to make good decisions, focused decisions on the pathogen that's creating the problems.
Right.
And as we know with PRRS, when there's multiple organisms involved in an infectious process, it's a lot worse. It's much, much worse.
And there's a lot of diseases out there that can look like each other, right? I mean, that's part of the problem, right?
Well, our challenge is to make decisions based off of the facts. And so if we're guessing what could be happening, or we're using a previous experience to try and diagnose a current problem, being specific is going to make us much more targeted. And in some of our herds, we're actually looking at 3 different populations. So we're looking at gilts and gilt entry, and we're looking at the sow farms themselves and how they are developing and growing, and then we're looking at the baby pig population, all which could be on site together. So we're looking at various different populations within the group.
Very good. Now, you do some consulting internationally. How are diagnostics used the same or differently globally?
That's an excellent question, because around the world we're not as fortunate as we are here in the United States with some of our laboratories. There are places we go that have outstanding laboratories, but here in the United States we're very fortunate that the universities, as well as some private labs and the companies that provide us the tools, are able to get very timely, very accurate, specific diagnostics. Some of the places we go in Asia are just begging for that type of diagnostics. And then some of our nearby partners, say to the north in Canada or to the south in Mexico, they have access to those labs. And so really being able to get the samples to the lab quickly, and then having a lab that is validated, that is well known, and can respond quickly with results. That's where it's most important.
And it's really regardless of where you're at in the world, right? I mean, diagnostics are playing a critical role for you.
Oh yes, and so in many of those regions where we go, there are multiple diseases, not just those that we're challenged with here in the United States, but say a pile-on effect of multiple other diseases in the area.
Very good. Well, thank you so much for your time today, Bill.
Thank you, Sarah.